Hi and welcome. My name is Matt Hazeldine from Lymphedema United, and welcome to our Meet the Experts series of videos, which features medical specialists and experts from the field of lymphedema and beyond that are on our Lymphedema United website. We're extremely grateful for their time and their expertise, because at the end of the day, they're here to help us to live better with lymphedema. Now, in this episode, I introduced Sally Kay, who is a multi-award-winning reflexology practitioner, researcher, educator, and author, a very busy lady. Sally has developed Reflexology Lymph Drainage, or you may have heard it called RLD, from first principles and through extensive clinical practice. This groundbreaking, innovative approach to reflexology has attracted national and international awards and widespread recognition. So welcome, Sally.
Thank you, Matt. That's a lovely introduction there too. Thank you very much. It's a pleasure to be here.
Well, we're very grateful for your time, Sally. And without further ado, let's go straight into the first question. So I was very aware of reflexology and have had several treatments from my local reflexologists. But it wasn't until I was doing some research for my book that I stumbled across Reflexology Lymph Drainage, or RLD. And to be perfectly honest, I hadn't heard anything about that at that point. So could you explain what RLD is and how you personally created this therapy, please?
Okay, thank you, Matt. So this is assuming that everybody knows what reflexology is. And so it's an ancient complementary therapy where the body's mapped out on the feet in what we call reflexes on a foot map for different systems of the body. So basically toes, head, shoulders, sort of below the toe. Got my foot here. So toes.
Not your foot, I hope.
No. Shoulder line, lungs, waistline and pelvis here. So the body is mapped out on foot. And I was working in cancer care in Southeast Wales Valleys for a wonderful organisation. And they had lots of different complementary therapists there, including somebody who did manual lymph drainage with people who had secondary lymphedema. And she was off for prolonged periods of time. And I'm also qualified in massage aromatherapy. By now I'd done some advanced massage stuff as well, but not qualified in manual lymph drainage. But it occurred to me, well, I understand it. I understand the principles of it. What would happen if I apply the principles of that to the reflexes of the feet? And that's exactly what I set about doing, applying that MLD sequence to the lymphatic reflexes on the feet and working them in the same order to adhere to the basic principles of MLD. And patients started to say, oh, I can feel movement, I can feel a tingling, I can feel all sorts of sensations, that many of you will be familiar with when you receive MLD. So it was clear to me that something was happening. And they would say, oh, look, my sleeve's a bit loose. Oh, my rings are a bit looser. They also then might experience things like increased urination, which again is common after an MLD treatment. There were many, many similarities. And so I carried on working with people, and then one day put a tape measure around somebody's arm before and again afterwards, and there was a significant reduction. Obviously at that point it's just a crude measurement, but this point went down by more than 1 centimetre. So something was definitely happening. Yeah, so that's really how I got started. And I was coming towards the final year of a degree as a very mature student in complementary therapies and had to do a piece of research. So that's how the protocol that I teach now is formalized, because I had to go through NHS ethics and they obviously need to know what you're going to do as part of your study, to make sure you do no harm. And the results of that study and subsequent studies have shown a statistically significant reduction in swelling.
Really? Well, that's incredible. And it's the reduction that interests me personally. I mean, I
Yeah.
enjoy reflexology, um, but the objective personally for me having it is to reduce the swelling. So what types of lymphedema could you treat? What would RLD be most effective for? And what about primary, secondary arms and legs? So is it going to help everybody, or is it quite specific?
Okay. So one of the problems with that is that every case is so different. So in the research, it was just with women who had breast cancer related lymphedema in one arm. So you use the normal arm as a control and you compare the swollen arm to that. But since my first presentation in 2012 at a Camstrand conference, reflexologists started saying, can you teach us how to do this? And the academics were saying, we need to do more research here. So really it's been a decade of work. The research has only been building on the secondary lymphedema for breast cancer, but thousands of reflexologists all over the world have trained. Before the pandemic, I used to travel, and now people are able to access it online. And what we find is that it's also bringing relief to other conditions. So like you mentioned, bilateral swelling, primary lymphedema, and also lipodema.
Oh, right.
People are getting some good results. But that said, I think we have to be very careful when managing expectations of treatment outcomes, because somebody might be vulnerable and looking for a miracle cure, and I totally get that. I really do get that. So I haven't researched any of the other conditions, but only seen anecdotal evidence from case studies. And when I was doing face-to-face training, part of the training would involve giving and receiving a treatment, and there would often be somebody there with primary lymphedema, secondary lymphedema, or lipodema, who reported feeling a change. But when you're moving the lymph around, only a certain amount can drain back at any one time anyway. So the greater the swelling, the more work it's going to take to cause a reduction. Does that help?
Yeah, so it's not a quick fix then.
It's not a quick
I mean,
fix.
we who have lymphedema understand that there is no quick fix, there's no cure. It's all about self-management and the 4 cornerstones of self-care, which includes massage. You
Yes.
mentioned MLD, manual lymphatic drainage, but this is fantastic that there's another treatment or therapy available.
Yes.
And I'm guessing it's quite specialist, something I couldn't do for myself, obviously, whereas SLD, or self-lymphatic drainage, or simple lymphatic drainage, depending on who you talk to, I can have a go at, although I'm not very good personally. But RLD obviously is a specialist therapy. So how long would it take for somebody to train to do that, who's already a reflexologist?
If you're already a reflexologist, it's a 2-day course to add on. So my training isn't for the general public or people with lymphedema. It's very much for reflexologists, as is my book. So I don't want anyone to be misled into thinking, oh, I'll get that book because I've got lymphedema. My book really is for reflexologists.
Right, okay. Well,
I just want to make that clear.
If we have any reflexologists watching this video, do you have your book to hand that you could just hold up so that
I do that.
Give it a quick plug then, Sally.
I do. Thank you. And I have yours.
Oh, no, put that one away. But no, this is about you, dear. So hold your book up again, Sally, and let the professional who might be watching, let them know where they can get that book from.
Okay, so this is available from Amazon. It's full color, and I'm very proud of it. It took me 7 years to write.
Wow.
Thank you, Matt.
Pleasure. Well, I can't claim mine took 7 years to write. More like 7 months pulling everything together. But honestly, I've seen it. I've actually passed my copy on to my local reflexologist, who's trained with you to do RLD, and she's very keen to get her hands on me at the moment. In a professional sense, I hasten to add. So listen, Sally, I'm a figures man. I like targets. I like goals. Have you had any successes where you say, I have reduced a limb by X%?
Oh, yes. Absolutely, yes. One that comes to, there are many. One that comes to mind is a client of mine who, when she first came to me, her arm was 29.9% bigger than her normal arm. She's very petite, she's size 2 feet, so she's, you know, a small person. So that's a lot of fluid. And as you know, when we measure, we can only measure from the wrist to the armpit. So it's just the cylinder volume that we measure with the arm.
Mm-hmm.
She also had swelling in her hand and up here. In fact, when you looked at her, you could see it. Her arm now is running around the 5%.
Wow.
Yeah.
Now,
5.
without giving any personal details away, what was her condition? How did she get
It was breast cancer related lymphedema in one side. And when she came to me, she'd already been, it was 10 years ago.
Right.
She'd had lymphedema for 10 years,
Right.
and it had become progressively worse. She wears compression, she's compliant with her compression and exercises. But what this has meant by the arm going down, instead of being in a negative spiral of loss of confidence, this has improved her body image, her self-confidence, and become a new normal, because living with the lymphedema swelling in her arm was her normal. And it's debilitating, because she used to say to me that when she woke up in the morning, it was the first thing she thought about. But as we've managed to reduce that right down, it's no longer the first thing she thinks about.
That's wonderful. And I've spoken to many cancer survivors that have had lymphedema since launching Lymphedema United, and I have to say that in a few cases I can have lodged in my mind that the lymphedema for them is more traumatic than the cancer treatment that they went through, because they're, as you say, they're waking up to it every single day. So that's brilliant news that you've managed to reduce her arm swelling, and I'm sure that's changed her life. Does she still wear compression?
She does. She does. She has a full sleeve, but it's a much smaller size than the one she had when she first came to see me.
Okay, so talking with a male hat on for a second,
okay,
which I can talk very confidently with having my male hat. I had my lymph nodes removed from my groin, my left groin, when they thought it was a suspected hernia. It wasn't. When they operated, they took out my nodes. No doubt I'd signed a waiver at some point, and sent them off for biopsy, and thankfully they were not cancerous. But of course, the damage had been done, the nodes had been taken, and a few years later I got lymphedema in my left leg. Now, funnily enough, talking to other guys who have joined Lymphedema United, I'm not alone. That seems to be not exclusive in the way that some chaps get lymphedema, and I dare say some women as well. So could RLD help reduce the swelling in my leg? Because I've had my nodes removed in my groin in the same way that perhaps cancer patients would have nodes removed from their armpits. Would it work for me?
I would expect it to work for you, yes. I always expect this to work, and generally it does. But I think for a logical person, somebody who likes facts and figures and data, it's almost quite hard to get your head around, well, she's only touching my feet, so how can this be reducing the swelling in my arm? And that's one of the things about reflexology, is because we don't understand the mechanism of action. It's very hard to get it accepted, because we can all get our heads around the idea that if you're manually massaging somebody, massaging an area of the body, then you're going to be affecting a change. But when you're only touching the feet, it's actually quite hard to get your head around that really working, which is one of the reasons that I get so excited about this, mostly because it's a pleasant treatment that helps people and makes a difference. And I've seen it over and over and over. But it's measurable. And it brings hope to those who feel hopeless by what they've been left with, for however whatever's happened, that you've ended up with lymphedema. It can feel pretty hopeless for some people, you know, because you get told there's no cure for this. You can, like you said, you can just manage it at 4 corners of self-care and so on. And yet this really does make a difference.
Well, I'm one of the biggest skeptics out there, Sally, and I have to say, with reflexology and the treatments that I've had from two therapists, without mentioning their names, they'll be treating my feet, and all of a sudden I like an electric shock will go through me, like a bolt of comfortable pain, if that makes sense, nice pain. And they go, yep, that's your such and such, or that's your, wow, yeah, well, I actually have had some issues with that recently.
Yes.
You know, all this skepticism, and I'm constantly looking up on the wall with the feet maps that, you know, with each part of your body linking to a certain position of your feet,
Yes.
to check what's wrong with me. Why is that? Keep getting told off. Yes, it was the same as last time. It's the same place as this time, and every time I do it, the same thing happens. So it's quite fascinating. I have to say, it's an enjoyable treatment, and of course, you know, you feel the benefits. You can feel the pain, the pinch points of where the treatment's benefiting. So without divulging what I'm doing locally, is there a typical cost per session that you would expect somebody to pay privately, or is it available on the NHS? But what's the cost element for somebody who have RLD?
Sadly, it's not available on the NHS. Although the university in Cardiff who've been driving the research, the RLD research, they're beginning to look at some cost benefit analysis research, because there are thousands of reflexologists out there who could make a difference to people. And then there's a huge backlog of patients waiting for appointments to see the lymphedema teams in the hospital. So, you know, that would be really good, that. But I think basically it depends where you live. It depends who you see and where you live, because, you know, treatments in London might be expected to be very expensive because the overheads for clinic space and thing would be that much higher. You know, very, very hard to put a number on that, I'm sorry.
Okay, no problem. So I suppose the question is, we need to speak to our local therapist.
Yes.
Or
Yeah.
visit their websites. And
Yes.
how many therapists are in the UK who are qualified under your watchful eye to provide RLD?
Do you know, Matt, I couldn't put a number on it, but I would say there are thousands. There
Wow.
are thousands of people who have reflexologists who would be able to offer this training. And actually it's available in some form or another in more than 30 countries, or approximately 30 countries. I always love adding another country to the register. So for anyone who's looking for some RLD,
Yes.
on the Reflexology Lymph Drainage website, you'll find a register of practitioners. So those are people who've trained with me and submitted a case study. So that you can rest assured that it is someone who's helped with you, because, as I said, people are often vulnerable. They may be up late at night looking online for a miracle cure. They've been told nothing can be done. They read somewhere that, oh, look, I believe reflexology can help. But then for me, it's really important that they find their way to somebody who is RLD trained with me. I'm the only person who does this training. And I know if somebody's done the training, they will be able to help. Because if they went somewhere that, you know, see, reflexology isn't regulated. It's only voluntary regulation. So if they went to someone who'd just done a half-day course, was now calling themselves a reflexologist, that would be bad for the person, very bad for them, because it wouldn't work, and bad for reflexology. And I don't want to see either of those things happen.
No, I understand.
Yeah, you can find practitioners, and if you can't find somebody near you on there, then the RLD Facebook group is quite a big group, or you can find me on social media and message me. And very often through this big group, I'd be able to connect someone with somebody who's maybe trained recently and is looking for a case study. You know, that's the good side of social media, when you can connect people in a way with something that is going to help. Because not everybody, particularly pre-pandemic, not everybody who came on the course ever got round to sending a case study. They just got out, they get on and do the work. But funnily enough, the online training, which I was wary about, There's been a very, very high uptake of quality case studies from the online training, which is great because it reassures me that it hasn't lost its magic by taking it online, because if that was the case, I wouldn't have done it.
No.
I'd have stopped because it's really important to me that the protocol doesn't lose its integrity and just get lost in a sort of sea of lots of different types of reflexology and different applications.
So there is a register which I'll point people to shortly, but you know, one of the things that we're keen to endorse, if you like, is making sure that somebody with lymphedema is being treated by a qualified individual. And I know when I've been looking for therapists in the past for MLD or manual lymphatic drainage, I look out for the MLD UK logo. I look out for the BLS logo. So have you got anything to hand that you could show us that symbolizes the logo we should be looking for, Sally, to check?
Okay.
There
Can you see? Oh,
yeah.
can't get my feet.
So
That's my little logo there.
So pink circle with a foot and a ribbon, pink ribbon on it. So
bow on the toe.
On the toe. Sorry, a bow on the toe.
It's a bow on the toe. So
think of that, bow on the toe.
Well, the pink bow was originally a nod. The idea was a nod to the breast cancer bow, because when I first started with this, that's what it was all about. All the other stuff has just happened. It's snowballed, and people are realizing how good these techniques are for all kinds of conditions. In the same way, MLD is used for many things other than lymphedema.
Yeah.
RLD will help. Well, I believe RLD will help, and I've seen lots of evidence of it too.
And as we referred to earlier, it's not a quick fix, but do you foresee a certain number of sessions that one would need, or is it an ongoing program? What's involved?
Well, in the research, I did 4 sessions, and we've done that in each of the subsequent studies as well. So week 1 is just a baseline measurement, data collection, and then 4 sessions, same time, same day of the week, and then follow up at week 6. And that has given us a statistically significant reduction in swelling. But in my clinical practice, the lady I was talking about who's gone from being 29.9% to around the 5%. So she might be up to 6 or down to 4.5, but we haven't been able to get below that. She came frequently at the beginning, sort of weekly or fortnightly, and then she went down to monthly. And after about 6 sessions, the pattern of the results seemed to plateau a little bit. And I was a bit afraid that maybe that was it, we weren't going to get any more. And she said, well, you know, let's keep going. It might be like a diet where you lose the most at the beginning and then the weight loss slows down. And sure enough, that's exactly what's happened as we've tracked it she has been coming for years now. But she says it's changed her life. And in that time, what I believe it also does, it re-enables people to feel less disabled and more enabled to take control of their well-being. Maybe if you feel better in yourself, maybe you're more inclined to go swimming or re-engage because things don't feel so hopeless. And I did have one lovely case in my first study of somebody who joined a gym and started doing Zumba during the study. And when I asked her, what stopped you doing that before? She said, oh, I couldn't. Everybody would have been staring at my arm. Now, the chances are people probably wouldn't have been staring, but she was too self-conscious to go. And ironically, the Zumba and the swimming would help to sustain the results that she was getting from the RLD, as well as help her, you know, mental health and general feeling of well-being. So there's a ripple effect. RLD can be a catalyst for change. It's hope. That I think that's what it brings to people.
Well, you know, the number of times I've used that word, you know, what are we looking for in addition to maintaining as best we can the swelling. It's the hope that at some point in the future it will get significantly better. And I'm thrilled to hear that case study that you've mentioned. Not only would it, I'm sure it have affected her self-esteem, but I bet you she was able to fit into a lot of her clothes in the wardrobe that perhaps were made redundant when her arm was 30% bigger than.
Yes.
So that in itself, gives you that confidence back, that self-esteem back, I'm guessing.
Absolutely. Yes, that was in my mind to say when I was talking about her, because she's very well dressed. She's a lovely lady, has lovely clothes, and she kept items like nice silk blouses and a nice suede jacket, but she'd been unable to wear them for the best part of a decade. And it meant so much to her when she could wear these things again.
Yes.
In the same way, if somebody can't wear their wedding ring because they've got swelling in their finger, to be able to wear these things again, I always believe that it's the small things that make the biggest difference.
Well, this has been incredibly uplifting, I have to say. So positive, and it gives, let's use that word again, hope that there's another therapy that can help us. And perhaps it may not work for everybody, but it's definitely worth trying. So you've mentioned the register, and just to repeat the information there, Sally's details, if you don't mind me pointing people to Lymphedema United for a second, or they can contact you directly on everything they need to know about you and your treatments, and your bio is on the Meet the Expert section of Lymphedema United. And there are links to Sally's website. There are details about her service and social media. So have a browse. If not, Sally, here's your opportunity if you just want to give us your website slowly so people can write it down.
Basically, it's just Reflexology Lymph Drainage.co.uk. And also, if you use social media, the Reflexology Lymph Drainage Facebook group, it isn't just for reflexologists, and many times we have contacts, we can put you in touch with someone. There are also MLD therapists who are reflexologists as well, who interact on the Facebook group, and everybody's welcome. It's an inclusive place.
Oh, well, it's been an absolute pleasure. I've really enjoyed talking with you, Sally, and thank you for all your hope and the new therapy that you've brought to our lives. And I hope that once I get cracking with this RLD on my leg, I have a similar reaction to your lady. Thank you so much, ladies and gentlemen. I'd like to say thank you, please, to Sally Kay for her time. And we look forward to seeing you again in a future session, perhaps with a demonstration as to how you do RLD.
Thank you, Matt. Thank you very much. And thanks for all you do as well to bring everything together to help people who are searching for information.
Yeah, well, that's very kind of you, but I'm going to edit that bit because it's about you.
No, don't leave it in. I'll know it's missing.
Thank you so much. And
thank you.
Stay tuned, guys. Have a look at the YouTube channel. There's other videos with Meet the Experts, Meet the Charities, Meet the Organizations, and Meet the Suppliers. So please follow us or subscribe to the YouTube channel, and we'll see you at the next video. Take care.